Hi, this is John Pagel, and again, I'm going to discuss some of the newer agents that were presented at the American Society of Hematology meeting in San Diego in December of 2016. I'm focusing here on this presentation on a plenary presentation, a very important presentation that explored the use of a newer generation anti-CD20 antibody known as obinutuzumab compared to the use of the standard antibody, rituximab, when used in combination with chemotherapy. The trial was a very well-designed, large trial where patients were randomized to get a standard induction chemotherapy regimen, such as bendamustine-containing or CHOP-containing or CVP-containing, with an antibody, randomized to either get obinutuzumab or rituximab. And then patients were then allowed to go on and expected to go on to get maintenance therapy with the antibody they were assigned to. So it was a randomization of two different antibodies used in combinations with chemotherapy and then a subsequent maintenance phase with either of the antibodies that you were assigned to. What was seen is that regardless of what chemotherapy backbone were chosen, patients did about the same. But the use of the obinutuzumab, the newer anti-CD20 antibody, showed a significant improvement in progression-free survival, which means a longer time till people either progressed or relapsed with their disease, and patients therefore had a much longer time before they needed their next line of treatment. That was a significant improvement over those patients who were randomized to get the rituximab-containing regimens and the rituximab maintenance therapy. It's important to note, however, that there were more side effects or toxicities in the obinutuzumab arm for those who were randomized there. And overall, the survival was really no different with the relatively short follow-up, but people were living about the same amount of time regardless of which antibody they were randomized to receive. There might be a specific subset of patients who were going to dramatically benefit from the obinutuzumab, but right now, despite the very promising data here, it's still very controversial about which antibody to choose, and perhaps even what the safest is and what will be the advantage to obinutuzumab in a long-term survival analysis. More data will be needed to be found and discovered before final recommendations can be determined.